Quite interesting to see that especially patients with borderline personality disorder who receive high doses of antipsychotics initially appear emotionally unresponsive, which I believe in some cases is a pharmacological side effect of the antipsychotics. So they are emotionally blunted and their expression is reduced. And over therapy we can observe in some patients that their emotional responsivity increases with reduction of antipsychotics in particular. But this is not scientific, this is anecdotal. So I've seen maybe several, I don't know, maybe several hundreds of patients, but I have never quantitatively evaluated this question. I can't tell much more than that.
Okay, thank you.
More questions? Yes, Eduardo Argudo.
Thank you very much for your presentation. There are evidences that neuroleptics improve in some degree some dimensions of the PPD.
Yes.
There are some evidences that neuroleptics decrease the production of oxytocin. So, what if we give neuroleptics to the patient and oxytocin to the therapist, or the relatives, all the couples of the patient? I understand that attachment phenomena are relational. So our focus is not the individual, not even the couple, not even a dyadic relationship. It could be our minimal unit of analysis should be a triadic relationship.
Yeah.
So what about starting to experiment with triadic relationships? Therapist, couple, or mother, patient, therapist, and testing drugs or psychotherapists in such settings. That's my question.
Thank you. Yeah, it's a very interesting question. Of course, I can't predict the outcome of such a study, but two things I would consider relevant to take into account. One is that, as I briefly mentioned, borderline behavior is often transferred from generation to generation non-genetically. So this makes sense in an evolutionary perspective. If somebody is unresponsive and so forth, this is what I explained, he or she might be unwilling to invest much in own offspring. So next generation grows up under similar conditions than the person, him or herself, before. So giving such people oxytocin, so both of them, like mother and patient, being perhaps insecurely attached, and then you give them oxytocin, may perhaps worsen the situation, even in triadic relationships with a therapist, but maybe it's worth a try. And if you look at couple interaction, I would like to mention the concept of assortative mating. That's another evolutionary concept, which means that the choice of a mate is not random, but that people with specific personality traits choose as a mate perhaps somebody who is or compatible with their predictions of future resource availability. In other words, I think it happens very often that people, especially women with borderline personality disorder, choose antisocial men, abusive men, and so forth as mates, as partners. So if you give such people oxytocin, it may also produce an unpredictable result. I would be very careful in designing such an experiment, I must say. Yeah.
My reflection comes from reading Stephen Jay Gould's evolutionary theory, where he says that our focus when thinking about evolution should not be the individual, like Darwin said, but a population or even a species.
Yeah.
So maybe the advantages are not for the individual, but for its relatives or its lineage.
Yeah, this is a hotly debated issue among evolutionary theorists. What is the unit of selection? And most agree that the unit of selection is the individual organism. And in part, perhaps with regard to humans, the tribal group, especially if there is genetic relationship within the group. So if there is kinship selection. Selection at the level of the species is perhaps something that is not very prominent in nature. So most people would object to Gould's interpretation nowadays. Yeah.
More questions? Anyone? Perhaps in Spanish, if it's easier. Martín?
The last one. I would like to know your opinion about individual psychotherapy and group psychotherapy. Groupal psychotherapy. Could you tell something about the differences? Perhaps are there differential neurobiological mechanism in individual psychotherapy and group psychotherapy or not? Are they equally potent to induce changes in our minds? What's your opinion about that?
Very good question. I'm not aware of good data regarding that question. Maybe there are data which I'm unaware of, but I think both individual psychotherapy and group therapy has advantages and disadvantages. So ideally, I would perhaps even suggest to combine the two for at least for some patients. With regard to borderline patients, I find group therapy very helpful because of the interaction among patients during group settings, which I think are often very stimulating for all the participants. But I can see that individual psychotherapy may perhaps be more productive in terms of attachment relationships, which is perhaps weaker in group therapy. But, just a guess, don't know if that's true.
Okay. Last question, Natalia.
I would like to know, are there more studies about this scale, the ethological coding system interview? Because it seems interesting, it might be applied to other disorders.
Yes. Originally, Alfonso Trisi has used the scale for studies in schizophrenia, but also depression. quite interesting findings showing that patients with schizophrenia, for example, are reduced in their expression of prosocial behavior. Even that's also true for unmedicated patients with schizophrenia. In depression, it's quite interesting that the study of nonverbal behavior can even be predictive for the outcome of the treatment at admission. So if you look at the nonverbal behavior of depressed patients on admission, you can, in retrospect of course, you can predict the outcome of the antidepressive therapy. And aside from Tracy's studies, there has been a Dutch group from the Netherlands studying nonverbal behavior, using a different sort of scale that has produced very interesting findings, but mainly in depression. There is very, very little research on personality disorder, and perhaps even less for other groups of disorders. I should say, perhaps as a last remark, it's extremely time-consuming to analyze the nonverbal data. So, on average, you need at least 1 hour of evaluation for a 10-minute interview, because you have to watch it over and over again to get all the 37 items scored for the individual 15-second interval. But a nice approach, I think.
Last question, Rosa Molina.
Yeah, Martin, thank you for your talk. You mentioned the amygdala and orbitofrontal frontal cortex on BPD patients, and I'm aware there are several studies on attachment and how attachment during childhood can influence these brain areas. And I was wondering if you are aware of other studies in your area using oxytocin and these brain areas. Like are they trying to validate these kind of studies with functionals?
Yes. Thank you. Yeah, there are a couple of functional MRI studies showing that oxytocin reduces the activity in the amygdala in borderline patients. So it seems to have a dampening effect. And that might explain the reduction in flight behavior in a nonverbal condition. It might explain the reduction of the experience of stress, which has also been studied behaviorally. So there is also a stress reduction in oxytocin in borderline patients. But it does not explain why other areas of behavior are apparently unresponsive or perhaps even negatively influenced by the administration of oxytocin. But this research has been carried out. So, for example, if you present borderline patients with facial expressions of anger and fear, this of course elicits a quite strong response in the amygdala. And under oxytocin, it's significantly attenuated.
Okay. Well, just finishing, I have taken notes. One of them is that the right percentage of people with antisocial personality in a community must be 1%. So in a psychiatric department, it's the same. No? 1% is enough. No? Okay. And obviously, I think we have to thank Martin Brunner for his wonderful presentation and debate and answers to our sometimes difficult questions. No? So thank you very much.
Thank you.
we see you at 4 here, and we will continue with Lola Morón. Okay?
Un par de cositas. Quien no haya firmado la hoja de